Hi, welcome to my Girls Night In talk on platelet-rich plasma. My name is Dr. Julia Fisher, and I'm a board-certified dermatologist and fellowship-trained Mohs surgeon here at JUVAskin&LaserCenter. I practice medical, cosmetic, and surgical dermatology. So what is platelet-rich plasma? Platelet-rich plasma is a procedure during which a patient's platelets are extracted from their blood and concentrated in order to be used therapeutically when either injected or placed onto the skin after a different procedure. Platelets contain growth factors and other molecules that can trigger beneficial cellular processes within the skin. And platelet-rich plasma, also known as PRP, has been shown to improve hair loss, wrinkles, acne scars, and like I mentioned, has been used post-procedurally for rejuvenation and also for the treatment of stretch marks. At Juva, we actually use a specific type of PRP known as a platelet-rich fibrin matrix, which has been shown to help concentrate these growth factors where we put them, and to keep them sticking around longer so that the benefits are maintained. So the most common problem that I use PRP for is for hair loss. It's a very popular treatment, and typically for patients, the most common disorder is androgenetic alopecia. This is also known as a male pattern or female pattern hair loss. And there are many different treatments that we can use for androgenetic alopecia. But what's interesting about PRP is that studies show that patients are actually happier with their results with PRP than when compared to other more conventional treatments like Rogaine. Other disorders that I use PRP for are for something called telogen effluvium, which is a very common post-pregnancy, and it can actually help to restore the hair a little bit faster and prevent some of that post-pregnancy hair loss. And also can be seen after stressful events. And there's also some data to support using PRP for inflammatory hair loss, and we've had some success in select cases at Juva as well. So, what is the process? So, like I mentioned, a patient's blood is extracted. So just like a regular blood draw that you would get at your primary care doctor for your annual physical. And the blood is then spun down in a centrifuge, and this platelet-rich plasma, or this concentrated plasma, is extracted. And then you can see it here, the liquid gold being drawn up into syringes so that it can be used in the skin. So here you can actually see I'm injecting it into the scalp. And usually patients will require either 4 to 6 treatments, and they're usually monthly. And I usually tell patients that they will notice results after 2 to 3 treatment sessions. So you have to give it a couple of treatment sessions to really see whether the results are going to be robust for you. And after you complete the treatment course, usually I recommend patients do maintenance treatments, and that'll really be very patient specific, usually 6 to 12 months, every 6 to 12 months or as needed. But I mentioned many injections in the scalp, or not many, but a few injections in the scalp. And patients tend to be a little bit nervous about that. But the good news is we have Pronox at Juva, and Pronox is basically laughing gas. And we can use this to, in addition to, some of the air chillers and other things that we have in our clinic, in order to make this a very comfortable experience for you. So just a couple of before and afters. These are photos from the literature, from some of the studies that have been published, and you can see these patients really had very profound results in their hair loss. And PRP has been shown to not only increase the density of hair, but also increase the actual caliber of the hairs and make them thicker than those thin kind of hairs that you start to notice with androgenetic alopecia. And then these are just some more photos from the literature, and you can see again that the patients in the after photos have pretty significant results that can be seen with the naked eye. So our key word for our socio app Girls Night In Play to Win game is Plasma 2020. So be sure to jot that down and enter it into the Play to Win option in your socio app in order to compete for a grand prize. So what else is PRP used for? So PRP can be used for rejuvenation. So it has been injected in the skin for specifically for the treatment of periorbital or the wrinkles around the eyes, for crow's feet, and even for dark circles. And the idea is that it is thought to increase the thickness of the skin and make those dark circles a little bit less evident. Other things that it's been used for is to be applied or injected into the skin after other procedures, after energy-based procedures like radiofrequency microneedling, after laser resurfacing procedures, and even after surgical subcision of scars. And they've been shown, PRP has been shown to decrease the downtime after these procedures. It's been shown to speed up recovery and also to boost some of the results that you can get from these procedures. So oftentimes patients will opt for adding this into their procedure because they want to get the maximum benefit for those results. And it also has been shown to decrease some of the redness and pigmentation after procedure, so that, like I mentioned, that the recovery is a lot faster and you get to those endpoint results much quicker. So just a couple more before and after photos. So I'm sorry, the one on the left is a little bit blurry, but you can still see that there is a benefit in the skin here, and this is combined with a CO2 laser resurfacing. And the photo on the right, you can see has also been combined with a similar resurfacing laser, an erbium resurfacing laser. And you can see here, again, for acne scarring, significant improvement when combined with CO2 laser, and also here combined with surgical subcision of these scars on the right. And then this is a great example of PRP being used without any other procedures, actually just injected into the skin for the treatment of melasma, which is pigmentation of the skin, which is a pretty stubborn condition to treat. And I think that this photo shows some pretty impressive results. And like I mentioned earlier, also stretch marks. This is just one example of PRP being used in combination with other treatments in order to improve the results for the treatment of stretch marks. And stretch marks are a pretty difficult condition to treat. So I thought that this was a pretty impressive result as well. But what's important to keep in mind for PRP, that it is a excellent procedure in itself, but as you can tell, a lot of the things that I've mentioned, it's a great procedure to combine with other things. And you know, the whole is greater than the sum of its parts. So, you know, each procedure, you know, laser resurfacing or microneedling in its own will give you great results, and PRP on its own can give you great results, but when combined together, you can get even better results. And same goes for even hair restoration. I always tell patients that, you know, the more things they're willing to do, the better results they'll get. And obviously this is something that we can discuss in our clinics to make sure that we pick the best treatment regimen for, you know, what it is that our patient is trying to achieve. So thank you for listening, and please follow us on social media. Enjoy Girls Night In.